I understand you've had some pain at the base of your thumb and in your hand, and that's actually a pretty common problem for somebody who is getting a little older in life. When I look at your hand, it's swollen right here. I don't know if you noticed that, but that's at the base of your thumb, and that's one of the classic physical exam findings of arthritis as well. I bet if I move that around a little bit, it's a little sore. So really, this is a very treatable problem, but if it's not treated, it can limit your hand function and it can result in a lot of pain. But if we were to treat it, some of the first kind of conservative things that we would start with are, some activity modification. Instead of trying to open the jar or a water bottle yourself, because I'm sure that causes you pain, you'd probably want to try that, get a jar opener, or ask, your husband or a friend to open your water bottles, things like that. You can wear a soft brace. We have them in our office. They're kind of like a little wetsuit material. Sometimes they can be made out of hard plastic, but they can stabilize that joint so that when you're trying to do forceful pinching and grasping, it doesn't hurt quite so much. Sometimes steroid injections will minimize pain. It's actually a pretty effective way to minimize pain. Unfortunately, it's just not a permanent fix, and it can only last for, several months at a time. Taking an anti-inflammatory like Advil or Aleve is helpful, but ultimately the most effective way to treat arthritis when it's progressed to some of the more final stages is surgery. And the way we do that is we remove one of the bones at the base of your thumb called the trapezium, and then we use a tendon in your forearm to perform a ligament reconstruction, which stabilizes it so that you have good motion in your thumb, and that your pain has been typically alleviated, but it provides enough stability that your thumb doesn't hurt anymore. It's really effective.